Vipul Janardan. I'm psychiatrist at the Institute of Human Behavior Allied Sciences, New Delhi. So I will be talking about premenstrual syndrome. Premenstrual syndrome is a collection of the psychological and somatic symptoms occur during the luteal phase of the menstrual cycle. Most of the women, 95%, have symptoms of mild severity. However, 5% suffer from severe symptoms. Severe PMS affect 3 to 8% of the women in reproductive age group. Morbidity with mood disorder is seen in 30-70%. In those with PMDD, the risk of postnatal depression is higher. ICD includes the term premenstrual tension syndrome under the heading disease of genitourinary tract. Severe PMS are classified as premenstrual dysphoric disorder in DSM-IV, while in DSM-V it is premenstrual syndrome. Uh, yeah, in this, out of the 11 symptoms, 5 should be there. These are depressed mood, marked anxiety, marked affective lability, marked anger or irritability, anhedonia, subjective sense of disability or difficulty in concentration, lethargy, easy fatigueness, marked change in appetite, overeating, hypersomnia or insomnia, subjective sense of being overwhelmed or out of control. Physical symptoms include breast tenderness, headache, joint or muscle pain, or sensation of the bloating or weight gain. These symptoms must have present most of the time during the last week of the luteal phase, must have begun to remit within a few days of the onset of the menstrual flow, and must be absent in the week after menses. Symptoms should markedly interfere in the work. They cannot be exacerbation of the another disorder, such as depressive disorder. The criteria must be confirmative by prospective daily rating of at least 2 consecutive menstrual cycle. A pattern of symptoms expression during each cycle. PMS symptoms generally last uh, for for few days to 2 weeks. The peak is 2 days before before the start of the menses. Now, what are the treatment modalities, or we can use or the treatment? So, in PMS, in mild cases like lifestyle modification, CBT, or exercise can be tried. But in the severe cases, wherever necessary, SSRIs are the drug generally that respond, and 60 to 90% uh, are effective compared to the placebo. So most out of SSRIs, citalopram, and the fluoxetine and sertraline are most studied drug. And one more thing is intermittent during the luteal phase of the menstrual cycle is also effective. The temporarily increased serotonin concentration during the luteal phase. Intermittent dosing is effective only in the luteal phase 2 weeks prior to the menses. Alprazolam can be used with caution in premenstrual insomnia and overwhelming anxiety. Hormonal replacement therapy can be used when other modality or other pharmacotherapy with the SSRIs are failed. So at that time, we can use the hormonal replacement therapy. Thank you.